I'm Michael Gold, and I'm a board-certified dermatologist from Nashville, Tennessee, and we have a pretty large dermatology practice here in Nashville, where we do not only medical dermatology, but a lot of cosmetic dermatology, a lot of clinical research in dermatology. Scars and wound management has been an interesting thing that I've been looking at for almost 30 years. So when I first came to Nashville, there was a small little article that I actually looked at in a magazine, Plastic Surgical magazine, where they actually discussed the use of using a silicone-based product to make scars better in some burn patients. I actually did the first work in dermatology on the use of silicone in the treatment of what we call hypertrophic or raised scars, or keloids, which are the really raised scars. When people come to my office, they don't realize I see scars all day long. I've sort of become known in this area as somebody that can take care of and handle scars. So Stratpharma is a Swiss-based company that has sort of changed the game. StrataMed and StrataCell are the first, we call film occlusive agents that we can actually put on wounds immediately. And we've never had that. So even if somebody has an open wound or a closed wound with sutures, we don't have to wait till the stitches come out. These are revolutionary products. They can be used, again, for different reasons. So if somebody has a surgical procedure or a scar that's new, we can use it immediately. In my other world of cosmetic dermatology, we can use this as a post-procedure product. So post-lasers, post-peels, post-other things that I do, microneedling, that help the wounds heal faster than conventional wound care alone. So we're finding lots and lots of different uses for these products, and they're the first of its kind, so that makes it really nice. Always gets asked is, if you have a wound, does it need to be wet? Does it need to be dry? Does it need to be moist? And that's an interesting scenario. And what's happened over the last 20, 30 years is that the dermatology world has realized and sort of taught the rest of the world that we don't want dry wounds. Okay, so the concept of lots of surgeons in the old days saying to people, soak it in vinegar, let it dry, wet to dry dressings, and so forth. That doesn't help what we call reepithelialize or heal the wounds faster. So we know that a moist wound environment is what we want. So when we do procedures or surgeries or laser procedures or whatever, we are actually looking to keep those wounds moist. And so we want to put wound healing agents on post-procedure that actually keep the wounds moist. So if you get a brown recluse spider and you have an open wound, we want to actually heal it through a moist environment. If I do a laser procedure, we don't want it to get dry. So we are constantly using things that actually keep the skin moist. So so using StrataCell or StrataMed actually helps with the moisturization of the wound and keeping it moist, letting the silicone occlusive properties do its thing in healing a wound. People always ask about, how common are scars? So just think about every part of your existence. Growing up, how many people scrape their skin? The nice part when we're young, wounds heal really quick and wounds heal really well. But as we get older, or if you have to have a procedure where you actually have to have something cut, you're going to have a scar. And again, there's lots of factors that play in what that scar looks like. So our genetics plays a huge role, our ethnicity plays a huge role, and if you're having a surgical procedure, actually the talents of the surgeon play a huge role in how wounds eventually heal. So we spend a lot of time in school and in teaching our residents and our other students how much tension you're allowed to put on a wound, what direction you want the surgical scar to go in, so we can either hide them in a normal area or that they are in the least amount of tension on the skin. But if you think about it, there's so many surgical procedures performed per year. Unfortunately, there's so many other injuries that occur every year, whether it's burns or as other traumatic injuries that we see on a regular basis. So scars are really common. They're probably one of the most common things out there in dermatology. We don't talk about them as much because they're harder to treat, and again, that's what I've been doing all these years. But we want people to know that there are things that can be done about it. You don't have to have an unsightly scar. You don't have to have a scar. I mean, you can minimize anything. You get cut, you're going to have a scar. Whether you see that scar or not is a different story. And again, with all the techniques that we have and all the combination things and using the Stratpharma products, I can minimize almost anything. The other thing that's really nice about these products is that they are resistant to bacteria. They're hydrophobic, which means they get onto the wound and they're going to allow the skin to breathe. What we know about these products, and StrataMed and StrataCell, they're occlusive, so they cover the wounds, and that occlusive barrier that is very important for the wound allows for wound healing to occur under the skin in a different method than just leaving it open to the air or your surroundings. When we use the silicone products like Strataderm on a closed wound, we know from, again, years of work that we can actually flatten and take that color change, if there is, back to normal. So that's what silicone gels do really well. So Strataderm, one of its advantages, it's cosmetically elegant. That's really important in my world. And again, we can use it to treat old scars, new scars, raised scars, the gamut of scars that people have that they're trying to flatten and make better looking from, once they have a scar. What the benefit for me, having products that I can put on immediately post-procedure or immediately post-surgery, then I can switch them to the longer-term treatments. That's what I like about having the different Stratpharma products that work really well for my patients.